Hello everyone, this is the Health Promotion Teaching Plan. The subject is HIV in young women in Africa. The problem is, for background information, Sub-Sahara Africa is home to the majority of people living with HIV, or 25 million out of 35 million globally. The significance to the community's health is 1 in 4 residents of Sub-Saharan Africa is infected with the HIV virus. 71% of new HIV infections worldwide happen in Sub-Saharan Africa. This is according to data from the World Health Organization from 2014. The Department of Defense has asked a group of students to do health promotion teaching on HIV in Africa. This supports Millennium Goal 6 to combat HIV, AIDS, malaria, and other diseases by educating young women on how to minimize their risks for contracting HIV. And that Millennium Goal is from the Millennium Project 2006. For our learning needs assessment, I would like to discuss the plan for assessing the learning needs of the community. Step 1 is to assess the learning readiness. We must assess the physical, emotional, experiential, and knowledge readiness of the subjects we're about to teach. This is according to Colbury in slideshows that were produced in 2016. Step 2 is to assess the participants' prior knowledge base by asking what they already know about the subject of HIV. Step 3 is to assess what learning needs are most important to the participants by asking them what do they want to learn. The priority needs for promoting health in the community will be determined based on gaps in their current knowledge found in Step 2 and what the community is most interested in learning about, which is found in Step 3. The Health Promotion Model. The health promotion model that we're going to use for this is Dr. Nola Pender's Health Promotion Model. The key components to Dr. Pender's health promotion model is that individuals strive to control their own behavior, individuals work to improve themselves and their environment, health professionals, such as nurses and doctors, comprise the interpersonal environment which influences individual behaviors. Self-initiated change of individual and environmental characteristics is essential to changing behavior. This model was selected because it emphasizes individual empowerment and environmental improvement. The reference is Pender, Mulder, and Parsons, 2015. The Health Promotion Health Education Plan. Here we're going to identify 1 goal and 3 behavioral outcomes that will indicate that the teaching plan has been successful. Our goal is that all of the young women will decrease their risk factors for HIV infection after targeted, focused, school-based educational packages presented in physical education classes and including the tool of dialogue. All the components of that goal will have evidence-based practice, which I'll go over later. The behavior number 1 is that the students will reduce their number of sexual partners. Behavior number 2 is that the students will increase their rate of condom use. Behavior number 3, the students who are not sexually active will delay sexual initiation. The educational methods and tools that will be used to teach the community described include focused school-based education packages, see Amaretto, Papalongas, Ochili, and Ali in 2014, presented in physical education classes, see Najela Sani, 2011, and including the tools of dialogue, see Kuragu and McLaughlin, 2011, role-play, integration with traditional games, health pamphlets, and hands-on workshops. The research and/or other evidence. Let me go over this further. Identify 3 evidence-based articles, identify where they were integrated into the teaching plan. I identified where they were integrated in the last slide, so I'll just go over the evidence-based articles. First, we have the effectiveness of HIV/AIDS in school-based health education programs in Nigeria, a systematic review. This was published in Health Education Research in the year 2014. Second evidence-based practice article is Unveiling Their Words, the Use of Dialogue as a Health Promotion Tool for HIV/AIDS Education in a Poor Community in Kenya, in the Journal of Sex Education, published in 2011. Then we have the research number 3, Preventing HIV/AIDS Education Through Physical Education, Reflections from Zambia. It was published in Third World Quarterly in 2011. And as you can see in the previous slide, we integrated into the teaching plan as educational methods and tools that will be used to teach the community. Evaluation. Identify an evaluation method and a tool to measure the success of the health promotion health plan. We're going to evaluate the effectiveness of the health promotion and health education plan. Will be evaluated by asking the participants to fill out a survey before the class and 6 months after the class, providing statistics as to how many new sexual partners they've had since the class first started, if they used a condom correctly with their last sex partner, and if they have become sexually active since the class started, and then compare their results with a control group that did not take the class. The outcome evaluation will focus on the results or changes brought about by the program, intended or unintended. That reference is Pender et al. 2015. In conclusion, I would like to discuss some ideas for the way forward. First off, I would like to bring these classes to more students. Second off, I would like to place an emphasis on the meaning and importance of consent and body autonomy. I want these girls to know that it is their choice to engage in sexual activities. It is their choice as to which HIV preventive tools they will use, and hopefully they will be empowered by knowing that they have these choices in order to make better health outcomes with their choices. And it has been found that an effective empowerment strategy would use activity-related effects as well as interpersonal and situational influences as a means of facilitating and enhancing patients' health-promoting behaviors. It's according to Karkin-Plarsa, 2014. And even though most new HIV infections in sub-Saharan Africa occur from heterosexual sexual contact, I would like to follow up with classes targeting the men who have sex with men population and the IV drug-using populations of sub-Saharan Africa. And this is my reference side. It's Almaguero. So it's the effectiveness. Yeah, this is my reference side. As you can see, I have lots of references, and I will allow you to research them all. And there's a lot of really good information in all of these references. Thank you very much for your time.